Melatonic believes in and strives for fair and reasonable access to local, sustainable, organically grown medicine of the highest quality. Our focus is to provide a safe, non-toxic alternative to overly prescribed pharmaceuticals, loosening the grip one patient at a time. Why you should choose Melatonic over alternatives. Melatonic oil are true full spectrum, meaning that natural amounts of CBC, CBG, and other cannabinoids, terpenes, and botanical compounds are present. True full spectrum creates a synergizing effect to enhance product's efficiency, also known as the entourage effect. Every D molecule is identical in every plant. Why are there such vast differences in effects from one plant to the next? The vastly different effects are attributed to the synergistic nature of a true full-spectrum oil. Unlike the poor quality, pharmacologically isolated and distilled products that saturate and confuse the current market with ineffective and possibly harmful false equivalents. Our are made in small batches from unique in-house genetics, extracted from flower, not byproduct, and are not extracted from hemp. All products are 100% organic, pesticide-free, and non-GMO. Our living soil regenerative cultivation practices promote sustainable agriculture. Regular laboratory testing by a third-party Health Canada-approved laboratory assures quality and consistency. Because we only provide the quantity of on the label, there is as much as 30% more other cannabinoids, terpenes, and botanical compounds in each bottle than advertised. In the average gram of true full-spectrum oil, there contains 666 milligrams of which means our 30 ml bottle, 800 milligrams, actually contains 1200 milligrams of true full-spectrum oil. This is not the case with isolated or distilled products. What is wrong with hemp extracts? Agricultural hemp and medical both come from the plant. Hemp has been bred for stock and seed production and contains very low amount of viable medical oil. Hemp is also harvested when seed and stalks are ready, not when the medical viable oils are matured. Marijuana contains a full spectrum of hundreds of compounds, many of which are classified as cannabinoids, such as CBC, CBG, CBN, and many that have not been researched and or named. Medical has been bred for high oil content. It is grown to maturity with the express purpose of medical oil extraction. Hemp is not. Isolated from hemp is extremely cheap to make out of hectares of industrial hemp fields. However, their effects pale in comparison to a true full-spectrum extract. Given that this medicine is a budding area of research, we are ever evolving our understanding and approach to stay up to date with all the most recent research regarding cannabis health and science. Potential health benefits of CBD. CBD is non-intoxicating, non-psychoactive, and non-addictive. An anti-inflammatory, pain relief, promotes skin health including acne and scar reduction, promotes healthy immune function, promotes relaxation and sleep, reduces anxiety and depression, and has anti-psychotic effect, suppresses muscle spasms, suppresses seizures and convulsions, reduces small intestinal contractions, alleviates vomiting and nausea, reduces the risk of arterial blockage, blood sugar reduction and diabetes prevention, inhibits cancer cell growth, neuroprotective and tempers neurodegenerative conditions, antibacterial, withdrawal symptom reduction. Potential adverse side effects of Though CBD is generally well tolerated and considered safe, it may cause adverse reactions in some individuals. Potential adverse side effects may include change in appetite and weight, fatigue, lower blood pressure, lightheadedness. CBD is also known to interact with some medications. Consultation with your doctor is important if you take medications or supplements with a grapefruit warning. Because both grapefruit and CBD interfere with cytochromes, a group of enzymes that are important for drug metabolism. Potential health benefits of pain relief. stimulates appetite, alleviates vomiting and nausea, suppresses muscle spasms, promotes improved sleep, inhibits cancer cell growth, relieves glaucoma, potential adverse side effects, increased heart rate, coordination difficulties, dry mouth, dry or red eyes, reduced reaction time, short-term memory loss, melatonic decline. Our 20-to-1 dominant tincture are recommended for those who prefer a non-narcotic effect. For an introduction to base products, the 1-to-1 tincture is recommended because the balance minimizes the potential intoxicating or psychoactive effects associated with. For those who prefer higher doses of, we recommend our indica for sedative effects or sativa for uplifting effects. True full-spectrum oil can be as much as twice as effective and long-lasting than isolated or distilled low-quality products. Tinctures can be administered sublingually under the tongue for rapid absorption through the blood-brain barrier. This method of administration is especially effective for anxiety or other neurological or cognitive conditions. Organic coconut medium-chain triglyceride (MCT) oil is the emulsifying liquid. Organic olive oil is also available on special request. Tinctures are free of artificial flavors for a natural taste. 20-to-1 tincture. The 20-to-1 tincture contains 25.5 milligrams of D and 1.2 milligrams of C per milliliter. Available in 3 sizes: 15 ml 400 milligrams, 30 ml 800 milligrams, and 120 ml 3200 milligrams. This is recommended for individuals who want the benefits of CBD and who either have a low tolerance for CBD or wish to avoid the intoxicating or psychoactive effects associated with it. This product is also very popular for pets. Suggested dose: 1 to 3 milligrams per 10 pounds, 4.5 kilograms body weight, once or twice daily. Dosage example: 140 pounds, 65 kilogram person will take 14 to 42 milligrams per dose, 0.5 milliliters to 1.5 milliliters. Due to low levels of CBD, one may choose to increase dosage levels with no expectation of euphoria or altered cognitive function. 1-to-1 tincture. The 1-to-1 tincture contains 13.3 milligrams of CBD and 13.3 milligrams of per milliliter. Available in 2 sizes: 15 milliliter 400 milligram and a 30 milliliter 800 milligram. This balanced tincture is recommended as an introduction for our base. We recommend a starting dose of 0.25 milliliters. Dosing may be gradually increased until your preferred level of effects. The effects may not be experienced for up to 3 hours. A second dose is not recommended within this time frame. Indica tincture. The indica THC tincture contains 26.6 milligrams per milliliter. Available in 2 sizes: 15 milliliter 400 milligrams and a 30 milliliter 800 milligrams. This THC dominant product is generally administered as a sleep aid because of its sedative couch lock effect. Effects may not be experienced for up to 3 hours. A second dose is not recommended within this time frame. Sativa tincture. The sativa tincture contains 26.6 milligrams of per milliliter. Available in 1 size: 15 milliliter 400 milligram. This dominant product is generally used in the daytime because of its uplifting effects. The effects may not be experienced for up to 3 hours. A second dose is not recommended within this time frame. Suppositories. Available in 2 formulas: 1-to-1, 25 milligrams D and 25 milligrams per suppository, or only 50 milligrams per suppository. Custom strengths available on special request. For example, 100 milligrams or 150 milligram 1-to-1 or per suppository. Available in a pack of 10. Designed for both vaginal and anal use. Organic cacao butter is the emulsifying agent. Suppositories are most commonly used to treat symptoms in the pelvic area. Example, prostate inflammation, menstrual cramps, colon cancer, IBS. Suppositories can also be used for conditions in which the stomach does not properly absorb oral medications, or to otherwise increase THC levels in the blood without the intoxicating/psychoactive effects. Suppositories do not have the intoxicating or psychoactive effects associated with THC because the active ingredient bypasses the liver and are absorbed directly into the bloodstream. Bypassing the liver prevents the conversion of into 11-hydroxy or other active metabolites that produce intoxicating or psychoactive effects. 2-to-1 topical salve. The topical salve contains 333 milligrams of and 167 milligrams of available in one size, 45 milliliter, 500 milligram. Soothes sore muscles, achy joints, insect bites, dry skin, eczema, and other skin conditions and irritations. Ingredients: organic unrefined shea butter, organic hemp seed oil, true full spectrum organic oil, beeswax, and rosemary oil. Available by special request. All can be made custom strength. Pure extracts for conditions that require larger doses. Dry flower, 20-to-1, 2-to-1, indica and sativa. Extra potent topicals for serious skin conditions, example skin cancer. Cannabis is integral to our health and is among the most complex plant on earth. We can help guide you through the process. Learn how cannabis and other plants can be integrated safely and effective for each unique situation. Please don't hesitate to draw on Melatonic owner and operator Patrick Bonin's vast knowledge on cannabis and other plant medicines by emailing your questions to melatonic@protonmail.com or calling Patrick directly at 250-551-7720. Thank you all for choosing Melatonic. True quality comes as God provides it.